So seeing as how every procedure has risks, what are the specific risks involved in cataract surgery?
So it is really, really important that your surgeon sits down with you and face-to-face before surgery explains the risks of cataract surgery or this lens exchange surgery. What's really, really helpful, both for patients but also for us as surgeons, is that recently the Royal College of Ophthalmologists, which is our regulatory, our college, our body which gives us our qualification as an ophthalmic surgeon, they have gotten together a working group and have gone through the risks of all these procedures, and they have written a patient guide and also a set of guidelines for us as surgeons about what we should be telling patients are the risks. And really we have to follow those guidelines, and they are absolutely explicit about what the risks are. And what those guidelines say is that the risk of losing significant vision, of ending up nearly blind, in one of your eyes is 1 in 10,000 operations, okay? That's incredibly small. The risk of it happening in both eyes is in the region of 1 in 12 million.
Right.
So very, very small risk, and that's a catastrophic outcome. To put it in context for you, I'm likely to do about 10, maybe 20,000 cataract operations in my career. So what that means is that somewhere during my career, I will have one or maybe two patients who lose a significant vision in one of their eyes. Touch wood, it hasn't happened yet, but it's, there is a potential for that to happen, and we have to be clear with patients on that. The second thing that the Royal College of Ophthalmologists insist we tell patients is that in 1 in 500 operations, the vision isn't quite right in one of the eyes. The vision is less than we expected it to be. Now, in many of those cases, it can absolutely be rectified, but would require some more treatment to correct the vision. And the last thing is that there's a whole host of minor complications that can arise from surgery. Inflammation of the eye, dryness of the surface of the eye, gritty sore eyes, high pressure in the eyes. But these are all treatable and manageable, and especially if you're being looked after individually by your consultant and you have access to him and the ability to contact him and say, look, my eyes are gritty and sore, then they will see you, treat this, address it, and it will go away. And it's a minor inconvenience, and overall we group these extra course of eye drops or a little bit of extra treatment into a 1% figure. So 1 in 100 people will need a little bit of treatment to sort out a minor complication after surgery. If you'd like to know more about vision correction surgery, give us a call and get started on your vision correction assessment.